Methodist Healthcare Ministries of South Texas serves the 74 counties of the Rio, Texas Conference of the United Methodist Church. The communities we serve are as varied as the South Texas landscape, and to effectively impact their unique healthcare needs, we use a different approach. Body, mind, and spirit, a community approach to healthcare.
Wesley nurses basically are a little bit different from traditional nurses in that we do a lot of community outreach. We're very involved not only in the church as a faith community nurse, but we're also involved in the community, working with whatever needs are around us, but not just filling needs, but including people in the community in our programming and using those assets of people who wish to collaborate with us, to work together to help in preventing.
We work a lot as advocates for our patients. We are educators. I do a lot of education. We are resource people for our patients. I do a lot of screenings. I am the first person a lot of times that they see. I'm sometimes the only provider that they see. And so I feel like we are the connection between that patient and healthcare in general.
Yeah, it's fantastic having the resources of MHM here at our church, and our Wesley Nurse is fantastic because she's very active in our community and acts as a great liaison for the community and the church, and that's what we're trying to do, is establish roots in this community and relationships.
I am doing a diabetes education support group, so our diabetics come in, and the nutritionist is here from Texas A&M, and she's going to go through meal plans with each client.
So working with the Wesley nurses has really helped us because we are not experts in the medical field. So we have been able to utilize them with our diabetes education to teach the medical portion. We also have a registered dietitian that comes in and teaches the nutrition portion. But these nurses are a wonderful resource for us. They have just been really good in helping us to reach out into the community so that we're taking care of the community and serving our clients.
Our nurses are located mostly in United Methodist churches within communities that have limited access to healthcare resources. Spanning 80 sites throughout our service area, Wesley nurses cover a lot of ground, but they aren't doing it alone.
Simple work to me is connect the people, connect the community, connect the communication. I guess your walking yellow pages. Somebody needs something, I can go find the information for them and call them and tell them, hey, this person is able to help you. This agency can help you. You know, this is who you need to go talk to. If I can be of any help, feel free to call me.
As a community counselor, my job is to be present in the community and to allow people in the community who maybe do not have access to counseling or do not have insurance to be able to receive our services.
We meet with individuals who are underserved, who are undocumented, who don't qualify for health insurance, and therefore would not be able to receive services in other community centers.
Right now we have 3 teams. We have a team in Corpus, and it's called the Coastal Bend team, one in Laredo, and then we have one here in the Valley.
We are licensed professional counselors or licensed clinical social workers, so we will provide the same type of counseling that you would see in any traditional setting. However, what makes us a little bit different is we are out there in different locations. We make ourselves more available to our clients. Our counselors are in church settings, in community centers, in women's shelters, and we really try to put ourselves in locations where our clients will not feel as intimidated and they will feel less threatened, and that will help ease into the healing process, and hopefully they will begin their journey a little bit sooner with us.
The thing that makes me feel good about this program is that it's helping the parents with parenting skills, and that it's parents helping parents. They support each other in this group. They talk to each other, they share ideas, and they're as much teachers as Claire and I are in this program.
We see it making differences in many lives, and the fact that Methodist Healthcare Ministries has given us the opportunity to reach out to people who did not have other ways of broadening their parenting skills is just wonderful. So thank you.
My favorite part in participating in this group is the overwhelming support and understanding you have with the other members, understanding that you're not alone in going through what you're going through. Many times as a parent, you feel like you're trying to do everything and that, you're not sure if you're doing it right, you're not sure, if you're following the right path or if what you're feeling is normal. So having other people around you that are going through similar situations and then being able to help each other with ideas, there's just that sense of togetherness. And I think that's just the most important thing of parents helping parents is that we're helping each other.
Get Fit is a program aimed at averting type 2 diabetes, obesity, and a sedentary lifestyle. And it's composed of two components. It has the after school and the summer program. The communities where Get Fit is hosted, it's in rural South Texas, small towns. There's very little resources there and very little to no access to healthcare. A lot of the kids in Get Fit are either being raised by single parents or the grandparents. A lot of them have not been out of their town. So the great thing about Get Fit is that we actually get to expose them to different things within the program, whether it be in a trip out of town or whether it be a new type of fruit that they normally would not get fed within that community. So the kids are able to take the information home and share it with their parents and their siblings. That way the family can be involved as a unit, whether it be cooking together or even just going outside and walking together, doing some sort of physical activity.
Together, our ministries address community needs to affect the population health throughout our service area. By using our localized holistic approach, we are able to tailor our programs for maximum impact in each of our communities and treat the body, mind, and spirit of the least served.